You know that feeling? You've got this stubborn cough, and you're bringing up phlegm that just won't quit. Welcome to This Explainer. Today, we're going to dive deep into the medical research together. We'll decode exactly what those different phlegm colors actually mean, uncover the 7 most common culprits behind it, and highlight the critical warning signs you absolutely shouldn't ignore.
So, have you been coughing up phlegm for days or maybe even weeks? Is it white, yellow, green, or maybe even blood-stained? It's so common for us to just look at a tissue and assume the color gives us an instant, exact diagnosis. But as we'll see, the science shows the reality is a bit more complex and, honestly, a lot more fascinating. Okay, here's our diagnostic journey for today. First, what is phlegm? Second, 7 causes of persistent phlegm. Third, the phlegm color guide. And finally, warning signs to never ignore. Let's jump right in. Section 1. What is phlegm? The protective fluid. You know, a lot of people use the words phlegm, mucus, and sputum completely interchangeably, but there's actually a really important medical distinction here. Mucus is just your normal, everyday protective fluid. It's produced all throughout your respiratory tract to trap dust, bacteria, and viruses before they can get deep into your lungs. Phlegm, on the other hand, which doctors call sputum, is specifically the mucus that comes from your lungs or lower airways, and it's usually what you cough up. When your lower airways get irritated or infected, the production of this specific protective fluid just dramatically kicks into overdrive. Moving on to Section 2, 7 causes of persistent phlegm. Identifying the culprits. So, here are our 7 main suspects. These causes range from your common, everyday irritants all the way up to serious infections. We've got viral infections, postnasal drip, smoking, chronic bronchitis or COPD, acid reflux, pneumonia, and tuberculosis. When a doctor investigates a persistent cough, they systematically rule these out based on your specific symptoms and history. Let's break these down. All right, the most common culprits by far are viral infections. Think the common cold, the flu, or COVID-19. In the first few days, your phlegm is usually clear or white. Then, as your immune system steps up to fight, it might turn yellow. These usually wrap up in a week or two. Now, right alongside viruses is postnasal drip. This is literally when mucus from your nose or sinuses constantly drips down the back of your throat. If you're always clearing your throat, or if your cough gets way worse at night or right when you wake up, postnasal drip from allergies or sinus issues is a highly likely suspect. Next up, we have to look at lifestyle and chronic conditions. Smoking is a huge one. It continuously irritates the airways, so your lungs are forced to produce extra mucus just to defend themselves against the toxic smoke. Over time, smokers often develop a really stubborn morning cough with thick phlegm. And get this, even if you quit, the research shows it actually takes weeks or even months for the lungs to fully clear that out. But if this phlegm sticks around for months on end, especially in current or former smokers, we have to consider chronic bronchitis. That's a form of COPD, which involved a daily cough, major mucus production, and shortness of breath lasting for months at a time. Catching this early is absolutely vital.
Now, this next suspect actually surprises a lot of people. Acid reflux. It turns out stomach acid can totally cause persistent phlegm. When that acid repeatedly splashes up into the throat, it irritates those delicate upper airway tissues. The result? Chronic throat clearing, morning mucus, hoarseness, and a nagging cough. And here's the real kicker. You can have all of these airway symptoms without ever feeling a trace of actual heartburn. Crazy, right?
Finally, we absolutely must rule out serious bacterial infections. Pneumonia is a deep lung infection, causing fever, chest pain, and a heavily productive cough where your phlegm might turn yellow, green, or even blood-stained. That definitely needs a doctor and usually antibiotics. Then there's tuberculosis, or TB. In countries where TB is more common, like Pakistan, a cough-producing phlegm for more than 2 or 3 weeks is a major red flag. Other warning signs include unexplained weight loss, night sweats, and coughing up blood. TB is completely treatable, but early diagnosis is absolutely crucial to cure the patient and stop the spread. Section 3. The Phlegm Color Guide. Decoding the evidence. Okay, looking at this diagnostic color guide, it's pretty amazing to see what your body is doing in real time. Clear phlegm is usually perfectly normal, or maybe a sign of simple allergies or the early stages of a virus. White phlegm usually means congestion. When your tissues swell, the mucus loses moisture and gets thick and cloudy. Now, yellow is actually a great sign that your immune system is actively fighting back. White blood cells are rushing to the site of the infection. Green points to a very high level of inflammation. Brown often shows up in heavy smokers or when old blood is mixed in. Red means fresh blood, and that should always be checked out by a pro. And black is very rare, usually tied to heavy environmental exposure like coal dust or severe fungal infections. Definitely seek immediate help for that. This brings us to a massive, massive medical myth. People always think that green or yellow phlegm automatically means you have a bacterial infection and that you absolutely need antibiotics. Well, the evidence shows that's just not true. That green color actually comes from specific enzymes released by your own white blood cells during the inflammatory process. Because of that, both viral and bacterial infections can produce dark green mucus. So taking antibiotics just because your phlegm is green won't do a single thing if the root cause is a virus. Section 4. Warning signs to never ignore. When to seek help. Look, there comes a point where you just have to stop playing detective on your own. Please get medical help right away if you're coughing up blood, having severe difficulty breathing, sharp chest pain, or a high fever. Also, if your phlegm lasts for more than 3 weeks, or if you're dealing with unexplained weight loss and persistent night sweats, you really need to see a doctor. These symptoms don't automatically guarantee a life-threatening illness, but they absolutely deserve a proper medical assessment to rule out things like pneumonia or TB. Ultimately, if there's one single thing you take away from this explainer today, let it be this fundamental truth. Phlegm is a protective response, not a disease itself. Your body is incredibly smart. It's just trying to protect you by trapping invaders and flushing them out. The phlegm and its color are really just offering helpful clues to help you and your doctor figure out exactly what your immune system is fighting off. Thanks for joining me today to decode the mysteries of phlegm. But what if you have a persistent, super annoying cough, but no fever, and you aren't really bringing up much phlegm at all? What could possibly be irritating your airway then? Well, if you want to keep following these diagnostic clues to uncover the 8 possible causes of a constant dry cough, make sure to check out our next explainer. Until then, listen to your body, stay curious, and take care of your health.